First, we'll go through a few different questions received today from Facebook. We have first David Ellingwood. He wanted to, I think, poke fun of my biceps or something like that. So he asked me, how do you get big biceps? And so I don't know what you're talking about, but I will let you see how my son is getting big biceps.
Pick it up.
I need you to show David Ellingwood how to lift weights, bud.
Pick it up.
Can you show David how to lift weights?
Now push it up.
Come on, show him how to do it. Show him how you get big biceps. Yeah, all right.
Now
Oh,
push it
that's so
down
good.
And pull it up again. Oh, yeah.
David, this is how you do it, man.
That's how you get guns.
Had to
right
bring in
there.
my 2.5-year-old. I hope you all enjoyed that. That's my little guy, Riley. He's 2.5 years old. He is working on his form, really trying to make some big gains. So he's doing a great job. Second question we had, a little more serious question, was we had a question from Ashley Sneed. She has an 11-year-old daughter and was curious if braces or Invisalign would be the right option for her, and was kind of faced with looking at both of those. And my advice with an 11-year-old is probably they don't have the full dentition or full teeth, all the permanent teeth. And so if you don't have all of your permanent teeth, it's difficult for any sort of orthodontic kind of final treatment. Braces can be addressed early on by doing some setting the stage or expanding the palate and getting the bone in the proper position as early as 6, 7, 8 years old. And Dr. Megan does an awesome job of that. It's called stage 1 orthodontic care. That's typically an appliance that we would use to get the bone in the proper position. But at age 11, probably doesn't have the fully erupted teeth. So Invisalign's really great with anybody who has all their teeth erupted and the trays can grab the teeth and move them. So if the tooth is barely out of the bone there, you can't really grab it very well. So you can kind of imagine how that might be a challenge for a tray to work. So then the other issue would be compliance or responsibility. And for that advice, I usually refer to the parent. The parent knows their child better than anyone else in the room. And so if you know that your child is responsible, then Invisalign is a fantastic solution. If you are concerned about their ability to wear the trays, lose the trays, then I would not encourage you to do Invisalign, and I'd maybe seek something more of a fixed option like braces. And then the last one I could kind of think of, last reason you might think about Invisalign versus braces would be if there's like an impacted tooth or a severe misalignment. It's amazing what we can treat with Invisalign. There's so much misrepresentation or misunderstanding of what the treatment is capable of doing. And so we can treat some really difficult stuff. Matter of fact, the other day, Crystal posted a great before and after photo of her treatment where she has a tooth way out of alignment. I'm sure many would say, no way, you can treat that with Invisalign. We're successfully treating that. We do that all the time. So if you've been told that before, then you might want to seek a second opinion from a very experienced Invisalign provider like ourselves at Innovative Dental. And so those are kind of the main reasons I would consider or think about when you're providing care for your child and deciding whether Invisalign or braces is going to be the best for you. And I just also wanted to send a thanks to April Roberts. She had an awesome before and after that she shared on our Facebook page, and here she is. I don't know if I can, pretty awesome. There you go, pretty cool. And she says, I could not be more happy with my Invisalign results. My teeth look amazing and I truly enjoy smiling. Thanks, Dr. Olson and your entire team. So thanks, April, for sharing your experience. Once again, there's a nice close-up of April smiling nice and big for us before and after. So very cool. So obviously I love hearing your questions and getting an opportunity to answer them in a more personable way rather than just text and typing. So keep them coming. If you have some questions that you want me to address, I'll try to do this periodically and keep you all in the know. So thanks so much.